Okay, get this. What if I told you that one of the most powerful treatments for deadly diseases back in the 1930s wasn't some new drug? It was a diet. A diet so simple and so strange it defied all medical logic at the time. We're going to dive into the absolutely fascinating story of the radical rice diet. So, could a meal like this, seriously, just white rice, fruit, and sugar, actually turn back the clock on some of the worst diseases people faced? I mean, it flies in the face of pretty much everything we're told about nutrition today, right? But here's the thing. The results were so staggering, they were impossible to ignore. And they were pointing to a hidden biological secret that we're only now really starting to understand. All right, so to really get just how revolutionary this diet was, you have to understand what things were like back then. So let's jump in a time machine and go back to the 1930s. This was an era before all the miracle drugs we have now. A time when, for their sickest patients, doctors honestly didn't have much more to offer than just hope. Just try to imagine this. In the 1930s, if you were diagnosed with something like malignant hypertension, that's super severe high blood pressure, or advanced kidney disease, that was basically it. It was a death sentence. Doctors just didn't have the tools to fight it. These patients were, for all intents and purposes, considered beyond help. And this is where Dr. Walter Kempner, a researcher over at Duke University, walks onto the scene. He comes forward with this absolutely radical idea. He thought, what if you could ease the massive burden on a failing body by using an incredibly simple, incredibly restrictive diet? And believe me, when I say restrictive, I am not kidding. That's it. That's the menu. No, really, just plain white rice, some fruit, fruit juice, and a little bit of sugar. There was no salts, barely any fat, and almost no protein. It was one of the most extreme therapeutic diets ever created. So, this super simple menu had some very specific properties. Now, Kempner was focused on the obvious stuff: low sodium, low fat, and low protein. But here's the kicker. He accidentally created a diet with another property he knew nothing about. It was extremely low in an amino acid called methionine. Now, you're going to want to remember that name, methionine. It turns out it's the key to this entire mystery. Okay, so you take these patients who've been told there's no hope for them, and you put them on what is probably the most boring diet in human history. So what do you think happened? Well, the results were nothing short of mind-blowing. They completely defied every medical expectation of the day. Get this, roughly 2/3, 2 out of every 3 of Kempner's hopeless patients got significantly better. That's not a small number, folks. That's a massive success rate for conditions that were otherwise considered a one-way ticket. And the physical changes you could see were just astounding. Their blood pressure would drop like a rock. Their hearts, which were often enlarged and strained from working so hard, would actually start to shrink back toward a normal size. Kidneys that were failing would often start to improve. This kind of stuff was basically science fiction back then. But here is where the story takes a really wild turn. When Kempner tried the diet on patients with diabetes, even he was skeptical. He thought, this high-carb, high-sugar diet has got to make them worse. But what he saw was the exact opposite. The results were just stunning. His diabetic patients' fasting blood sugar levels actually went down. Many of them needed way less insulin. And amazingly, about 30% saw improvements in their diabetic retinopathy. That's the eye damage that comes with the disease. A diet high in sugar and carbs was reversing symptoms of diabetes. I mean, how is that even possible? And this brings us right to the heart of the mystery, the big question that puzzled researchers for decades. The results were plain as day, but the why wasn't clear at all. Why on earth did this simple diet of rice and fruit work so incredibly well? Now, Kempner had his own theory. It was pretty straightforward. Super low sodium lowers blood pressure, and the really low protein gives the kidneys a much-needed break. And he was right. That was a huge part of it. But was it the whole story? Modern science started to wonder if maybe, just maybe, Kempner had accidentally stumbled upon something much, much deeper. And that leads us right back to that hidden clue we talked about, the missing piece of the puzzle, the one that Kempner himself never really identified, but that modern science is finally putting under a microscope. The answer seems to lie with methionine. So what is it? It's an essential amino acid, one of the building blocks of protein that you have to get from food. It's involved in tons of important processes in your body. And because the rice diet was so incredibly low in protein, it was, by default, also incredibly low in methionine. So here's the potential chain reaction that scientists think was happening. Step 1, you eat an extremely low-protein diet. Step 2, that means you get very little methionine. Step 3, this in turn causes the levels of another compound in your body called homocysteine to drop. And that right there, that's the key. Because today we know that lower homocysteine is linked to much better heart health and a healthier metabolism. This is very likely the secret weapon that was behind the diet's incredible success. So what's the big takeaway here? Well, the story of the rice diet is so much more than just some historical curiosity. It's a really powerful lesson in how looking back at old observations can spark brand new science. At the end of the day, Walter Kempner created one of the most effective dietary treatments in history, and it now looks like it worked its magic through a powerful biochemical pathway, that methionine restriction that he never even knew existed. It's like he found the right key for a lock without ever knowing how the lock was built. And that's really the biggest lesson here. It makes you wonder, doesn't it? What other groundbreaking secrets are just sitting there, hiding in plain sight in the pages of old medical books, just waiting for us to look back and connect the dots? It's a powerful reminder that sometimes the biggest discoveries come from revisiting the past.